So part of what our goal is to really let you guys know that sickle cell disease is a global disease, and that's what prompted this World Assessment Survey. I cover the United States. However, I have seen patients from Bahrain, from Nigeria, and from parts of the Caribbean. So, what is the International Sickle Cell World Assessment Survey, or called SWAY? It really was a very interesting process to get the name, but we really wanted to express the fact that sickle cell disease is a global disease, and we wanted to gather insights from not just patients, but also healthcare providers on sickle cell disease symptoms, impact on daily lives, and how patients were treated and their satisfaction with treatment. And James, you want to talk about your role in the SWAY survey and what was your intent in coming into this whole process?
Well, the Sickle Cell World Assessment Survey was very important to us because, as a charity, or if I use the term patient advocacy organisation, we have known anecdotally about the concerns that people have living with sickle cell about the impact of the condition on their daily lives, relationships, and all aspects of their lives, managing pain. So it was important for us to be part of a global piece of work that was able to compare whether or not those patient perceptions and experiences were similar and whether or not treatment and care was supporting the positive outcomes for those patients.
Absolutely. And we wanted to identify what are the unmet needs for sickle cell disease across the world, right? Because that would inform how we design, develop, and implement treatment strategies and ways to manage the disease that would improve quality of life for our patients. It's very important that we talk about the global nature of this survey because sickle cell disease is a global disease. There's really no country or continent in the world that doesn't house or to have a sickle cell individual.
And I want to emphasize the global nature of the survey because, as I understand it, this is the biggest survey of sickle cell patients. I think the survey was completed by over 2,000 people with sickle cell and over 300 healthcare professionals from 16 countries and across 5 continents. So that is a significant spread of the global picture of sickle cell across the world.
So now we'll talk about how the survey was developed and who were the participants. Just like Mr. James said, again, this was a multi-country survey of people affected by sickle cell disease and providers who take care of people with sickle cell disease. And it was developed by a panel of international experts, patient advocacy groups, and Novartis Pharmaceuticals. One thing I really appreciate, John, in the process of developing this survey was the input from the patient advocacy groups, because as providers, we tend to think about things in a very clinical and narrow perspective. You know, what happens in the clinic, what happens in the hospital, what happens in the ER. But your team, you brought a totally different perspective that I think really provided a robust texture to this survey.
Thank you, Iffy. And I think it's important because I feel that, and credit to all the patient advocacy organisations across the 16 countries, it really is important that the voice of the patient is understood in the context of why we did the Sickle Cell World Assessment Survey. Because much of the previous work, as you quite rightly say, Iffy, has been quite clinically focused, and this is one of the, if not the first, piece of work that is really looking at the experience and insights of people who live with sickle cell across the world. So that is a positive thing to provide the sort of balance to the valuable clinical insights that are given by healthcare professionals.
And it's important to think about any kind of condition, any type of research, any kind of work that's being done to help improve quality of life for patients, that it is patient centered. and it engages the patient's voice and the patient's perspective, because we would otherwise develop treatments that have nothing to do with what the patients need or want, and they will eventually be ineffective, and a whole bunch of time and money wasted because we're not addressing the true needs of the patient. What we did with the SWAY survey, we looked at patients in different cohorts. We had the children between ages 6 and 11 who required a parent or a guardian or a healthcare a care provider proxy to complete the survey. Those who were ages 12 and older could either do the survey themselves or have a proxy complete the survey on their behalf. And where relevant, the questions were asked in a 7-point Likert scale, where 5 to 7 indicated high severity and high impact, just to level set when you interpret the results of the study, how the data is being presented. So now we're going to delve into the results of the SWAY survey. So one of the things that we were fortunate to be able to identify is that, again, more than we probably appreciated before, and James, you can attest to this, that sickle cell disease has a substantial, pretty profound global impact on not just people's medical life, but their everyday life, their emotional life, their physical well-being, their relationships, how they do school and how they do work. And we were a little bit naive in thinking that in sickle cell disease, it's when they come into the hospital that you need to worry about what's going on with them. But James, what did you see in the results of the survey that you found maybe validating from the work that you do as an advocacy agency, and maybe a little bit surprising?
The survey demonstrated things that, as a patient advocacy organisation, we knew anecdotally, whether that was from parents or whether it was from individuals who live with sickle cell. And as you say, Iffy, there is no aspect of a person's life that is not affected. So from school to further education, to work, to relationships even at a work situation. So it was important to have that verified and confirmed, that it wasn't something that was peculiar to living with sickle cell in the United Kingdom or the United States, but that was a factor that was consistent across the 16 countries. And one of the things that I do want to highlight is the emotional and physical well-being aspect, because it's also clear that in some countries the ability to provide support emotionally, psychosocially, and so forth is not there. And in terms of the physical well-being, and we've talked about this before, the limited choice of treatments available is a factor that we know from those conversations in terms of how it impacts people's lives, that people find frustrating.
Yeah, and so as a physician, when I think about physical well-being, I'm usually limited to, are they admitted to the hospital? Are they seeking care for pain in the emergency room? And what I found is that physical well-being includes being able to take care of your children at home, right? Being able to play with your son in the backyard and play ball, being able to do your household chores, being able to get up every morning and go to your job. And these things were profoundly affected in sickle cell disease as revealed by this survey. And so it gives you a little bit of a behind the scenes or behind the curtain look as to, oh my goodness, this disease is not just about did they access healthcare, it's about every day to day experience of life for these individuals. I think patients reported that they are overall satisfied with the current level of management, but there was clear indication from the survey that we could do better. That maybe some people have accepted the poor quality of life as their normal and have zero expectations of getting better, which to me I found was very, very sad. I think if, as right now, I'm a pretty healthy person, if I happen to not be able to go to work for a week every month, I think that would be devastating. And for you to accept that as your normal because you have sickle cell disease is not acceptable.
as a patient organisation, it's very important for us to remind, encourage, and support all people who live with sickle cell to enable them to achieve their full potential. So, what that means is that they shouldn't be accepting of poor outcomes for treatment or poor care. And our job is to work with them to make sure that happens. And why that is important is because we know from the Sickle Cell World Assessment Survey that there is still unmet need out there for them, and additional support and alternative treatments are necessary.
Absolutely. And as we move along, I do want to encourage all the patient advocacy groups out there, do not rest on your laurels and not advocate for better quality of life for your patients and your clients. I think the more the healthcare system is challenged, the better we rise to the occasion, we innovate, and we help improve what we have to offer our individual and collective patients across all countries, across all continents in the world.
And I agree with that. One thing I would add to that is that this community, this sickle cell community, deserves better.
Absolutely.
Because you will know as a clinician, and I will know from a patient advocacy perspective, that for decades and decades there's been serious health inequalities for people who live with sickle cell and lesser access to disease modifying treatments.
Well, we defined vaso-occlusive crisis, or VOC, in SWAY as any severe pain crisis, whether they went to the hospital or whether they had it and they treated it at home. So it wasn't limited to accessing healthcare. So that's an important point. I think many studies out there look at VOC as only documented access to healthcare. The reason why this is important is many countries across the world do not have easy access to the emergency room or to the hospital. So if we're only looking at acute care utilization or hospital access, then we're going to miss most of the experience of VOCs in our patient population. Again, this survey looked at 2145 patients, and we found that on the average, they had 3 VOCs in the 12 months before they finished the survey. And this was consistent across all age groups, children under age 12 and adults and children between ages 12 and older. Again, that's a lot of pain. That's a lot of VOCs. And again, John, is this consistent what you see in your patients? Do you hear that they have pain at home, or is this something that is unusual?
It isn't unusual, Iffy. We know anecdotally that people who live with sickle cell try their very best to manage their vaso-occlusive crisis at home if they can. So, why is that here in the United Kingdom? And one of the reasons for that is that the experience of people with sickle cell attending accident and emergency or emergency rooms is one which is a poor experience. So the tendency is therefore, well, if I can manage it at home rather than go and explain what I've already explained to the clinician, or if they don't believe me that I'm in pain, or they think I'm a drug addict, which is another example that comes up. So it's all these factors which contribute to that median that has been identified. And I guess an interesting factor from the survey is that experience is consistent across the continents. So that was an interesting fact.
Yes. And I do want to point out that the median of 3 VOCs in the preceding 12 months was seen across the whole survey. However, there were some variations from country to country. Now, interestingly enough, Lebanon had a median of 12 VOCs in the preceding 12 months, and that was really interesting. The US had about 6, and Bahrain had about 5, and the lowest median incidence was in India. Now, we're not quite sure why there was this widespread in the rates of VOCs, the median rates of VOCs across continents or countries. But we will dig into the data a little bit more to really try to understand. Now, some of the hypotheses people have put out there include, maybe culturally people don't acknowledge VOCs in some countries, but I'm not quite sure how valid that argument is. But it is something that we need to kind of tease apart a little bit better to really understand why is Lebanon affected by 12 VOCs a year versus India with only one. And then the other thing that you mentioned, John, which I do want us to point out, is that the main reason why people treat their VOCs at home, if you're younger than 25 years of age, is because you don't really think that you need medical assistance. And that speaks to a lack of understanding and education about their disease. And it is our responsibility as healthcare providers and patient advocacy groups to really help educate these young people about the risk of VOCs that are not managed appropriately. There are some pain that you can manage at home, but they need to know what the danger signs are. They need to know when they need to seek healthcare. And we also know that there is a high mortality rate in our young adult population. And I wonder if the reason is that they treat more pain at home than they should, and they don't recognize when they're getting into trouble, versus the older patients who treat their pain at home because they had a prior poor experience in the emergency room. And so I think that there's a gap in understanding of what kind of pain or VOC should I manage at home and what kind of pain or VOC should I really go to the hospital for, because this may be life threatening. What do you think about that?
I agree with you, and I would just add that for that younger population, a factor is also about wanting to do what their peers are doing. So that younger group want to go out, enjoy themselves. Then, yes, they have sickle cell. So that lack of understanding about actually you can't do everything your peers in your age group can do is something that we need to do more about. And that's why organizations such as ours and other patient advocacy groups have to raise the understanding, particularly amongst the young group. But equally, there are those who do understand because mum, dad, and siblings have told them this is what you have to do. And for that group, there is still a reluctance to go. And just to give you an example, which is evident now, because we've dealt with it. So this is real. This is something that's happening now. Because of the COVID crisis and pandemic, so the coronavirus, it's clear that some people in the United Kingdom with sickle cell are frightened of going to hospital. And I guess that will have an impact on them attending. So we, as an organisation with clinicians, are saying, if there's a problem and you know there's a problem, go to hospital, because with a vaso-occlusive crisis, it could be fatal. So it's important that we get the right messages out, even in the climate with a pandemic that we're having to deal with across the world.
Absolutely. And just to kind of piggyback on what you said earlier, anecdotally, you have been seeing that there's 3, 4, 5, 6, 7 median VOCs in your clients in prior 12 months. I think now we have data. And I think the data speaks very loud and very clear that this is no longer just anecdotal evidence. There's data to support what you guys have been seeing, probably more than us in healthcare have been seeing, because we only look at VOCs as when they show up in our emergency room. And about a quarter of the people are not showing up in our hospitals because they think either they don't think they need healthcare, or they're afraid of coming because they had a bad experience. So again, the data is really telling.
And just one other point, the data is really important to have that data. And some of the preludes to the 2, 3, 4, or whatever number of VOCs is also information that we've picked up from the Sickle Cell World Assessment Survey, because we know from the advocacy work that we do that sometimes that first, second, and third may be linked to stress with looking after the children. It may be linked to difficulties at work. It may be linked to all those things in terms of the burden of the condition. All can contribute to those frequent VOCs.
Absolutely. Absolutely. There is a misunderstanding amongst healthcare providers. Not all, but some, the ER, the hospital members, most non sickle cell experts out there, that sickle cell patients predominantly abuse opioids or misuse opioids or are drug addicts or drug dependent. And that drives a lot of the stigma and negative interactions in healthcare. From the SWAY survey, we found that about half of the patients use opioids at some point in their life, and about a third were currently using them. Now, this is really important data because it belies what most healthcare providers think, that every sickle cell patient is on opioids and that they're using it all the time, every day, all day. And this data shows that about half have used it in the past, but only a third are using them currently at the time that they did the survey. Now, the reason why people use opioids, or the proportion of people who use opioids, varies based on where they live, their age, and the level of pain that they report. And this is what you would expect. You would expect that people who have more pain will use more opioid because they have more severe pain and they need something stronger than a Tylenol or acetaminophen or naproxen to address their pain. Now, what we found interesting was that there was a regional difference in using opioids. So the highest was in countries like North America and Europe and the Middle East, whereas other countries like Asia had a much lower percentage of people who use opioids. And we need to delve into the data a little bit more to further understand why there were some regional differences in opioid use. We also found that there was an age difference in opioid use. So the self-reported opioids was higher in people who were 26 or older in age compared to younger. And then also use of opioids was higher in those who had 5 or more VOCs per year and had more than 5 days of background pain a week. Now, this should be intuitive. More severe disease, more severe pain, usually in older people, tend to require stronger medication to treat their disease. But what it tells me is that we have not been able to adequately address disease severity. They don't have optimal disease management, so they're sicker, they have more pain, and hence the need for using stronger pain medication. And what it is a cry for help. It's a cry for healthcare, pharmaceutical companies, advocacy groups to really band together to do a better job in mitigating the disease complications, including the pain that they had that required that they use opioids. I'd like to hear from you, John. Like, how has this played out in your advocacy group? And when you hear things from your clients, is this similar, different? What are your thoughts about this?
Well, I have to say that the perception from particularly young black men who have to frequently attend A&E is that many healthcare professionals, first of all, don't always believe that they're in pain because they look fit and strapping, and you're really in pain at that level. So there's something we hear frequently about accepting the level of pain individuals are describing to healthcare professionals. And also a negative one is that the perception of them overusing opioids. And I may have used the term drug addict, but sometimes the prejudice is that, oh, you're only back here for another top up of whatever the opioid might be. So I guess the important point to make, which Sway has identified in terms of the patient insights, is back to the inequalities and challenges that patients face. That's the message. And I guess, you can think of that message in a wider sort of Black Lives Matter context, because it's about decades of having to deal with these things that really should be addressed as we move forward with new treatment. So I endorse fully the fact of everybody working together to address this problem which the survey has identified.
One other thing that struck me, James, in the SWAY survey is that while healthcare providers perceive sickle cell patients as overusing opioids and being drug addicts or drug seekers, patients themselves are concerned about using opioids.
Yes.
They are worried about the negative perception that it brings to them. They are worried about the side effects of the medication, both short term and long term. And so again, this feeds into the desperate need. We need to do better and provide better options for our patients because they're asking for better options, not just because people on the outside think that they're misusing their medicines or their opioids, but the patients want something better that isn't associated with so much stigma and that doesn't have as many side effects as what we're offering them. And so you're absolutely right. I think there's been decades and decades of presumptions and assumptions about the Black male, the Black female, the minority person, brown skin, who has sickle cell disease, and the link between opioid and opioid misuse. And people don't look at data, they look at their prejudices. And unfortunately, it has had a negative impact on our patient population. They don't seek care when they're supposed to. We lose them more than we should. And then we don't have the drive to improve the options that we give them. So this is really a call to action. It's a call to action that, you know what, opioids help to treat pain. People with sickle cell disease use them when they need them, when they are really sick, with more than 5 days of pain and more than 5 VOCs a year, and when they get older with enough cumulative disease burden, but they want something better. And they really, truly deserve something better.
I agree, and the call to action is important because, and I'm just using this data from the United Kingdom. But if we take London, the sickle cell disease is in the top 18 of all causes for emergency hospital admissions, and most of those will be around pain management because it's a crisis or something serious. So if these perceptions and inequalities persist, then there's a real problem for those patients.
I'm going to have you, John, because this is your area. Tell us what you gleaned from the SWAY survey. I think this is pretty fascinating. So I'm going to get my popcorn out.
Well, I think, and you touched on one of the reasons that there's a difference between the patient's perception and clinical perceptions. And what you said earlier is sometimes clinicians see the patients in front of them who are unwell, and they're not looking at the wider impacts of the condition. So I certainly think that is one of the reasons. And of course, and this is no criticism of clinicians, but sickle cell patients do know their condition very well. Those who are aware of the triggers know very well. And one of the frustrations sometimes, they say, is explaining this to, and it's mostly, trainee doctors or people who are on rotation or things like that.
No offense.
I know you wouldn't take any offense, but so I think those sorts of things will go to explain the discrepancy. And in terms of the survey, in terms of the Sickle Cell World Assessment Survey, we didn't introduce any discussion between patients and healthcare professionals about the impact on quality of life. So both parties are coming at it from the perspectives that they know.
And what we did find is that 69% of providers perceived that sickle cell had a high emotional, I'm sorry, patients had a high emotional impact versus 91% of HCPs. Impact on family and social life was higher amongst providers than amongst patients, and avoidance of physical activity was higher amongst providers, perception wise, versus patients. And again, that speaks to the fact that we can do a better job in communicating with each other. Because
Absolutely.
obviously, we're not getting the same message here.
Well, and that's one of the reasons, and that just verifies my earlier point about the fact that you see the patient in front of you and you're dealing with the symptoms that are in front of you. But the emotional factor, the social life, all those factors are very secondary to what you're dealing with at the moment, but they're not secondary to the patient who lives with the condition.
Yep. And the other piece is that, a lot of times when they come to healthcare, they tend to come with more severe disease. So we get colored in our perception because we tend to select out the zebras who are sicker. And then that becomes our perception of what sickle cell disease is like. Typically, people who are doing well don't want to come and see us. I don't want to go there. I'm doing fine. When I need them, I'll go, which we really want to not, we want to emphasize that that's not the right way to do this. We want to see you when you're well to help you stay well for as long as possible. And by the time you come when you're very, very sick, the treatment options become more limited. And so the idea of comprehensive care should be all sickle cell patients should be in comprehensive care, not just those on the extreme side of the bell-shaped curve. We want to be able to educate you when you're really, really well, because that will help you stay healthier by avoiding triggers, avoiding things that would impact your health, getting the right kind of screening done, getting the right kind of preventive and prophylactic treatments done, and then getting access to what's new and better in the sickle cell disease landscape. So again, we need to do a better job with bringing these two numbers together.
We do, Iffy, and I think that there's a thread in this conversation and the Sickle Cell World Assessment Survey, because seeing patients where the condition has worsened is in part, if we go back to the vaso-occlusive crisis and the fact that the media is because they don't want to come and see you unless they really have to come and see you. And that's demonstrated again by the data. If you look at the median, and I know the countries vary like Lebanon and so forth, but that is a factor. That is a factor of me saying, well, I'm not going to go, I'm going to stay and try and deal with this at home. And that may be building up problems over the years. So our job is to agree with you and say together we will do a better job, and for us to encourage them, as we are doing with COVID-19 at the moment. Don't hesitate. Go, comply, go to your appointments.
And so the thread again is that we both parties want better, right? The patients, the patient advocacy groups, and the providers want additional and alternative treatment options for sickle cell disease, not just for overall disease health, but for long-term pain relief. So again, I think this is the beginning of the next phase in our lives, and we're going to do a better job going forward. Now that we're armed with the SWAY data that really puts pen on paper to describe all we've known from anecdotes about what's going on in the sickle cell community. Excellent.
Absolutely. And can I just say, we should take your strap line of call for action and use the Sickle Cell World Assessment Survey as our call to action.
Absolutely. Yes, I agree. Mr. James, in summary, we have one of the largest, the largest 2,100 patient survey, provider survey that was done for sickle cell disease across the entire world. So not just the largest in number, but the broadest in geography. We've pulled together some significant data on not just the impact of sickle cell disease on people's physical life, but on their emotional and physical activity, as well as relationship impact. And we've identified the fact that there needs to be some better convergence in how patients see things and how providers see things. What would you say would be the next step? Like, where do we go next? What's the follow-up after this?
Well, that's a very good question, and I would hope that patient advocacy organisations and healthcare professionals are taking note of the evidence across the globe on where we are and taking action to deal with the issues that have been identified. And I think roll forward to an appropriate time, but we should revisit to see whether or not we are actually making progress based on what patients and parents with sickle cell are telling us. So that's the next stage, to compare and contrast based on this survey. And that will tell us in an appropriate timeline whether indeed the call for action to improve the options and treatment for patients with sickle cell is indeed going in the right direction, not plateauing and not declining.
Absolutely, absolutely. I do encourage everyone to take this data and disseminate this data. Spread the word, spread the information, share it with your providers, with your patient advocacy groups, with your clients, your patients, your family members, because the more people who know about this data, the better they can understand the rationale and the demand and the pressure and the urgency of the call to action, right? And then that would move towards efforts to improve what we've been doing. I think if you know better, you will do better. I think as more people know that, oh my goodness, sickle cell disease has this degree of an impact on my patients, that will motivate them to think really hard and deep about what else can I do for my patient. And I think it's going to motivate a lot of different stakeholders in looking at new, old, repurposed treatments, come up with new treatments, new ways of getting additional information from a patient population, whatever we can do to help drive the train towards a better quality of life for everybody affected by sickle cell disease, no matter where they live, whether they live in Lebanon or in the US or in India.
Absolutely.
Whether they have one VOC or 12 VOCs, right?
Agreed.
Yep. Well, thank you so much. And I hope this has been insightful information for our audience. And we look forward to getting additional data and sharing with you as we begin to delve into the sub-analysis of the SWAY survey. Thank you very much. Thank you, James.
Thank you. Thank you very much, Iffy. It's been a pleasure discussing this with you as usual.
Same here. Same here.